Good evening, everyone. I'm Peggy Chapman, Assistant Director at Yale School and a member of our transition team. I'd like to welcome our Yale parents and staff and everyone joining us tonight from Project Search, including TD Bank Project Search and our Yale Project Search program at Jefferson Health. I don't want to leave anybody out, so if your son or daughter attends a public school or another private school, we are so glad that you're with us tonight too, because we are all in this together and ready to learn as much as we can from our fantastic presenter, Michael Byrne. But first, we do have a full house tonight. We have about 70 folks or more. So we'd like to ask that everybody take a minute and please just mute your microphone. And Mike will let you know when he's going to open the floor for questions. In the meantime, you're welcome to also use the chat feature. I see some folks have already said hello to everyone and hello back to you too. So now I would like to introduce our presenter. Michael Byrne is a partner with Lighthouse Planning, a financial consulting firm affiliated with Lincoln Financial. Along with an undergraduate degree in business from Fairleigh Dickinson and a graduate degree from the University of Pennsylvania, Mike has 30 years experience providing financial advice. But most importantly, Mike has a deep understanding of special needs planning. He is a father to a special needs daughter, and he also has two brothers with special needs. So he has personal experience, the financial expertise, and the heart to guide parents and family members who need direction. So we are so very grateful that he's here with us tonight to do just that. Mike?
Thank you, Peggy. All right, so let me try and share my screen. You will stop others from sharing. Yes, I'm going to stop others. I'm going to share screen 3, I think. Let me try and do this. Stay with me. Okay. Slideshow. We're going to okay. Can everybody see that? Is that coming up as planning for special needs?
Yes.
Yes, it is, Mike.
Okay,
You're fine.
good.
Yes,
All right,
that's
good. All right.
good.
Now I just got to get my controls here. I lost something. I'll get it. Okay. All right. So, all right. So we can see planning for special needs up there. So let me, what I'm going to try and do is the format tonight. We're going to cover wills and trust. We're going to cover ABLE accounts. We're going to cover benefits. One of the most critical thing is how do you access benefits? So we're going to cover a lot tonight, and I'm going to cover it from a number of different perspectives. So what I'm going to do is this virtual format's somewhat new to me. So in the past, I've done live meetings where there is questions. We'll try and do questions, but I can assure you this. At the conclusion of this meeting, I'm going to give you my email and my phone number. So if there's questions that are specific to your child or the person that that you're trying to care for, feel free to reach out to my email. If there are a general question that the group would benefit from, great. But again, I'll be able to answer any questions. You'll have my email, no cost. Reach out to me. I'll get you answers. If I can't get you answers, I'll point you in the right direction. So my overview today, I want to cover it from a couple of different perspectives. One is I want to look at it from a financial perspective, because what we're trying to do is build a care plan here for our special needs loved one, and finances is a big part of that. That's the underpinning of it. The second thing we're going to look at is the legal perspective. So I've been through some of these workshops where attorneys will get up and talk all about the trust, but they forget about, well, how do you fund that trust? And then the third thing we're going to talk about tonight, I want to interlace in here, is the personal approach. How do we build this care plan so that when the time comes when you're no longer here, you have the best possibility that there's a safety net in place, and it's a strong and reliable safety net. So as Peggy mentioned, a little background on me, you'll see in the upper left-hand side, I got my brother, Chris. He's a year younger than me. He has special needs. On the right-hand side, I got my brother, Bill. He's a year older than me. Bill has, he's a special needs. He's with my mom, and my mom happens to be, as of a week ago, 90 years old. So I've watched my mom navigate through New Jersey benefit systems, and every time a new administration comes in and there's new rules, how do you navigate that? How do you remain qualified? And then in the bottom picture in the center is my daughter, Kelsey. That's a little bit dated from Special Olympics, but she's now just turned 30. So we've navigated her into the system, and we continue to navigate as all you do as parents. So we're going to walk through that. So some of the decisions that we have to make, what programs are available, and services are going to be available, because this is real important. And New Jersey is a pretty good state when it comes to that. So we're going to talk about that. We're going to talk about what happens when our child reaches the age of majority, which is 18 in the state of New Jersey. Who will care for us, our child, when we're no longer able as parents? So we're going to address that question. And we're going to talk about, these are the big questions. Where will my child live? And how's that going to work out? And what we're going to do is, who's going to know what's important for our child? So we're going to cover some of all these things. These are some of the hard decisions that we face as parents. I'm going to skip over this. This is a process we use, but let me briefly, if you look at this from a logical perspective, what we try and do is say, what are the family's needs? Because all of our children have different needs. We have some special needs adults that are functioning economically they're interwoven into the fabric of the community. They can pay rent, and their financial needs are very small. And then we have other children and young adults that have deep needs that the cost can be over $150,000 a year, depending on the needs of the child. So what are the needs? We're going to talk about evaluating resources, understanding the legal options we're going to cover tonight. Then what we'll do is, how do you craft a plan, and how do you implement that plan? And then how do you fund that plan? And then the last step is documenting the story, and I'll explain what that is. But that's really the owner's manual that we leave behind when we're no longer here. All right. So the focus today is going to be
176.
So the focus today is building a future plan. So to capture potential benefits and supports, how do we do that? And then what we're going to talk about is legal options, special needs trust, and family communication. All right. So again, my purpose today is really, I'd encourage you to create some awareness, but for you to take action, because what happens with all of us, sometimes this can be overwhelming. And we find out a year later, all the intended things that we wanted to do, we haven't really impacted any of them, because we find out, well, it's confusing, it's overwhelming, so we kind of get frozen. So I want to be sure at the end of today's presentation, you at least walk away with 3 action items that you can move forward on this path to having a future care plan in place. All right, so when we build that plan, there's basically 4 stages that we look for. So when I do my financial planning for clients that do not have special needs, what that is we have this planning when people are working, and then we have when they're retired. So we have these 2 stages that we plan for. Well, when we have special needs, we have 4 stages. So the first stage is infancy and childhood. So when our children are infants and they're in childhood, that's the first stage. And that first stage is they're in school, and up until 21, they're entitled to an education. The bus comes every day. We're entitled to that. The second stage is adulthood with us. That is when they graduate, they're 21, or if they've gone out earlier, but now they're considered adults, and they're with us. And the problem is the bus stops coming, all the entitlements stop coming. And before you were entitled to get it, now it's as available services from New Jersey. So that's the second stage we deal with. The third stage we deal with is adulthood without us. So hopefully our children reach a point where maybe they have the capacity and the capability maybe to live in a supervised apartment. It may be a group home. It may be independently in their own apartment. But there's that adulthood without us. Here I live now in Collingswood. 4 blocks away, my daughter lives in a row house. And we'll talk a little bit more about that housing option, that some of the creative things that are being created out there. So that I'm in the adulthood without you kind of stage. Although during the pandemic, I'm vacillating back to the yellow box, which is fine by me. We're getting a lot of time together, me and Kelsey. But so we're in adulthood without you. And then the 4th stage is when you're gone. And this is the one that we really need to plan for, because they say the prayer of a special needs parent is that our children live this long and happy life, and that we live one day longer just to be sure they're safe and okay. And although that's our prayer, the reality is for most of our children, that won't be the case. So we need to put some type of plan in place that says when we're gone, we want to be sure that our children have a safety net in place for them. And how do we build that? How do we build it financially, legally? And we're going to kind of unpack those things tonight. All right. So, as I said, we do planning, retirement planning. Basically, it's kind of like doing retirement planning for 3. For the husband and wife, if it's a single parent family, retirement for the single parent, and then retirement, we need to have enough assets for our special needs child. And at the same time, what we have, if there's other children in the family, we want to be sure that we've also done planning for our other children. So I have a daughter you saw in that picture, and she was standing next to her brother. Her brother, who was a little bit younger than her, what I was trying to do is craft a plan that would put a safety net in place for my daughter, Kelsey. But at the same time, I didn't want to neglect my son, Kevin, and be sure there was educational funding. He had the opportunity to go off to college. So as parents, we have lots of obligations that we have to balance. And sometimes I see parents that get overwhelmed, and I'm not being judgmental here, but they get overwhelmed and they just don't do anything because they kind of freeze, which is an understandable occurrence, but not a wise one. And then I see other parents that get so consumed by taking care of and being sure their special needs child is taken care of that they financially neglect other children in the family. And as parents, we have that balance we have to strike. So we're going to talk about that. So financial needs, we'll talk about that first. How do you determine the financial needs? As I said earlier in my opening, I got a brother who, my older brother lives in an apartment up in Morristown, New Jersey, North Jersey, near Parsippany. It's a 1-bedroom studio apartment. He's been living there since he's 30. He knows everybody in town. Everybody in town knows him. He's interwoven into the fabric in the community. He went to work every day for 40 years. At his dishwashing job, and he felt his self-esteem and he had a place to work, and his financial needs actually are small. He doesn't have big needs. He doesn't have big expenses. He has a HUD voucher for his apartment. So he's got his money saved up. Believe it or not, over all these years, he's got more money saved than most people that have worked jobs that pay 10 times as much. And so his needs are small, and he doesn't have psychological needs, doesn't have medical needs. Can he read? No. But can he get to town? Does he know everybody? Is interwoven in the community? Yes. Now, other people, they're going to have deep needs. So I have clients who have children that have health issues or need 24-hour care, and that cost can be $150,000, $200,000 a year. So determining those financial needs is an important thing. How much money will be needed? And what I'm going to share with you is that people go, I'm not sure. And that's the most common refrain, I'm not sure, because you're not sure what your child's going to need, and you're also not sure what New Jersey's going to have available. So understand that, and we'll show you how we deal with that issue. Who's going to pay? How are we going to get the money? Unless we win the lottery or we have rich uncles, we got to find some place to get that money. And sometimes there's only so much we can earn. Where is it going to come from? Okay, so those are some of the things we're going to talk about. So how do we let's look at resources, and we're going to move in the benefits here in a minute. So when we look at resources, the first place we look is family resources. The second place we're going to look is we're going to look at government benefits. And government benefits, I can share with you, are critical. Government benefits are things like SSI, which is Supplemental Security Income, which is a key component in this safety net for our children. So we're going to look at government benefits tonight. How do we qualify? And those government benefits come in two forms. They come in cash, where our children will get a check every month, but they also come in services. And services are important. Services can be vocational assistance, job training. They can be life skill training. They can be my daughter getting from services right now. Well, before she was furloughed, Uber would come by each day, pick her up, take her to work 6 miles to Audubon, and take her back each day. And that was picked up in the government benefits and services. So services can come in many forms, but those are important. All right, so now we know we got to look for these potential funding sources. Now, for some of our children, and there's a lot of children I know in the TD program and the Jefferson program, a lot of their resources are going to come from work, and which is great, because not only do they get money from work, they get something even more valuable, which is self-esteem. The second thing, it's going to come from family resources. So when my brothers, they worked, they put their money away, they saved their money, that's one source. But the second source is my father had put some money, a little bit he could save up, he saved up. He put some life insurance in a trust, and that's the second place. So savings that my parents had. And then, as I mentioned, the insurance, but the biggest component of this funding source that's going to be the foundation of almost everything is going to be government benefits. So it's important that we know how to tap into government benefits, because that's where we're going to have the safety net and the biggest bucket. Now, so our goal right now is, how do we create a plan that maximizes all the benefits and the supports that are available, which is SSI, Supplemental Security, Medicare, Medicaid, and we're going to talk about those things right now. So benefit programs. I'm going to give you some terminology first. The first is SSI, and that's Supplemental Security Income. 99% of our children or young adults are going to be utilizing this program, Supplemental Security Income. For those of you that are older, my age, we used to call that welfare. So welfare was a government program that was put in place for those that had no assets. All right. And our children will fall into that category, at least when they start. So Supplemental Security Income is one of the key components we're going to talk about tonight. It's a need-based program. So you don't have to, unlike Social Security, where you have to work 40 quarters to qualify, it's need-based. It has a medical insurance component, and that comes in the form of Medicaid, and that's the health insurance. And to qualify for it, you have two limits. You have an income limit. Substantially gainful employment is the SGA, that's the Social Security term, and that can be about $1,200 a month. And we're going to talk a little bit about that, because there's a misunderstanding on that. And there's an asset limit of $2,000. If you have more than $2,000 in your name, you don't qualify. All right, the second benefit that you're going to come across as you navigate this time utilizing government benefits is SSDI, Supplement or Social Security Disability Income. So some of our children are going to have jobs, and then when they lose that job, they have enough quarters, they're going to qualify for disability. Disability is entitlement based. You have to have a certain number of quarters, and there, instead of Medicaid, you get Medicare, which is a better program than Medicaid. It pays more. Many more doctors will take Medicare, but it also has an income limit. And then the last piece that we're going to talk about tonight is the Social Security. We all know that our grandparents utilize, and or maybe some of us are utilizing Social Security retirement income. And that's, again, that's an entitlement program. Medicare comes with it, and there's an age limit. You need to be 66 or 65 or 67, depending on when you're born, to qualify for. So let's kind of walk through how does that impact us and our families. So one thing is we're going to talk about is disability or DDD eligibility. So your children are in school, they have an IEP, and when they come out, what we need to do is we need to apply for benefits. And the first thing we need to do is qualify for DDD, Department of Developmental Disability eligibility, so we can start to tap into services. And there we need to document the disability. There's a process for that, but they'll look at the IEP, they'll look at the history. There's functional criteria they look at, and what they're looking at most importantly for DDD eligibility is, are they Medicaid eligible? Okay, I can't tell you how important this is, because it used to be before my brothers were getting DDD services. And then what happened is, remember, they were born back in the 50s, and they started saving money and saving money. And a few years ago, the state of New Jersey said, we're going to Medicaid eligibility because we want to use federal dollars to help fund this DDD programs we're providing. And they went out to other people and they said, so you need to be Medicaid eligible. Well, to be Medicaid eligible, the easiest way to become Medicaid eligible is get SSI. But the problem with SSI is you can't have more than $2,000 in your name. So my brothers weren't eligible, even though they totally qualified on the first two criteria. They were not Medicaid eligible. Now that's a story for another time, how you navigate around that. But the biggest thing I can tell you, remember this, as parents, your children need to be Medicaid eligible if they want to tap into government benefits. And if they want to tap into government benefits and get Medicaid eligible, the best way is to get SSI. If you qualify for SSI, you are Medicaid eligible, which opens up all the services. Okay. So I'm going to reemphasize that in bold print. Your children, if they're graduating out, do not skip. If you think, yeah, I think they're going to do okay, maybe they're not going to need services, I'm telling you, get them eligible for SSI, even if they collect it for 1 year, 1 month. Is once they collect SSI for at least 1 month, they open the door to Medicaid eligibility, because you never know what the future is going to hold. All right, so Medicaid eligible. The first thing is, if you qualify for SSI, earned income has to be under $1,200 a month. You apply for it when you're age 18, okay? And assets of less than $2,000. All right, and then we're going to talk about one more term, which is called a DAC status, and the disabled adult child is what it stands for. And it's a term I just want you to be familiar with, because sometimes what happens is parents they retire and they get Social Security benefits. And as a result, what you're going to see in a minute when I show you a chart, all of a sudden their children get some benefits and they lose their Medicaid eligibility. They become ineligible. This DAC status, which we'll talk about, is a tool that allows you to reclaim their eligibility. All right, so timeline for students exiting school and turning 21. Step one is to apply for Medicaid eligibility, and we can walk through how we do that. The second thing to do is apply for DDD eligibility. So the Medicaid eligibility is through the SSI, and there's a website you go through, as well as you're going to contact Social Security. And then after the student turns 18, what you'll do is you'll contact DDD eligibility to get them placed for DDD. Now, the third step is you're going to complete this. It used to be called a comprehensive assessment. So what they have is they go through, we had to do it a couple of years ago when they redid this. They go through you get called up and they go through a test, and it's a bunch of questions. Can your child bathe themselves? Can they feed themselves? Can they cross the street? Can they take public transportation? And what I can tell you is there's a new program, this new program they've launched in New Jersey. I say new, it's 5 or 7 years old. It used to be when our children graduated and they weren't going to go into the workforce, they were going to go into some kind of program. You picked a program and that was it. You could go into this day program or that day program. What they've done is they've recrafted the whole support system to say, no, we're not going to do that anymore. What we're going to do is when children graduate that need DDD support, what we're going to do is we're going to assess them. And based on that assessment, we're going to apply a budget to them. And that budget, you as the parents will have a say in. So I have parents that take that budget and they have someone going for recreation. They go bowling twice a week. They have someone come into the house and help them with life skills. They have someone help them with some vocational skills. So you can craft a budget to do whatever is the best and most appropriate plan for your son or daughter. Now, that budget I'm talking about is based upon this assessment. So you're going to get, these people are going to call you up. Now, listen, as a special needs parent, when people ask me about my child, I am so proud of what she's accomplished. But when I talk about her sometimes I illuminate or accentuate maybe some skills that maybe she's not as strong as. When you're doing this assessment, what I encourage you is don't fall into that trap. And I'm not saying mislead and never lie, never mislead, but don't paint an optimistic picture. All right. So if someone says, can your daughter cook? I can tell you, I would tell you no. Okay. Can she make microwave popcorn? Yeah. Can she put together maybe soup? Yeah. But can she cook? No. And the reason you want to be honest about that, can my daughter navigate a bus line? If she took the same bus 100 times, maybe, but she couldn't go over to Philadelphia and take a bus. You want to answer those questions as raw as you can and do not be optimistic, because that will determine your budget. And that budget can go from $16,000 a year to up over $60,000, $70,000 a year, depending on the severity and the needs of your child. So the comprehensive assessment is something you'll be given, and then DDD will apply a budget for you. All right. And then what we have now is, remember before I told you the old way was, all right, your child needs help. Here's a program. You're going to this day program, or you're going here, and that's it. And if you don't like that, there's another one. Now what you're going to get is you're going to get a support coordination agency. And New Jersey is going to reach out to you and say, your child's now eligible for DDD. You need to pick a support coordination agency. And they're going to give you a list of 8 or 10 that work in Camden or Burlington or Gloucester County. And then you pick from that. And that's once your child graduates and you're using those services is when all this will come into play. But it's at that point you need to select a support coordination agency. And then you're going to ask, well, which ones are good? So what I can tell you is reach out to your people at Yale, but reach out to me if you want, and I can give you what I know about the different agencies so you can pick a support coordinator that can assist you in crafting this plan for your son or daughter. Okay. So now we've talked about how do we go about the application process. Now let's talk a little bit of understanding benefits. So benefits come in two forms. One is there's some income rules. There's entitlement benefits that you're entitled to, and they have income rules. And then there's need-based benefits, and those you're not entitled. You didn't have to do 40 quarters of work. If you have a need, you are able to get those benefits, but they have an income and an asset limit that you need to be aware of. The benefits come in two forms. They come in cash, where your child will get a check, and then they come in services. And services can be healthcare, such as Medicare or Medicaid. They can be workshops, they can be day programs, they can be residential placements. So that if your child has needs that requires a residential placement, that'll be covered under that. Now, there's a couple of forms. There's SSDI, again, is an entitlement program, all right? And then we have retirement income, that's an entitlement. On the need-based program, let me come over here. On the need side, we have SSI. And again, that's where 99% of our children are going to qualify, at least initially, is with SSI. So on the entitlement programs, you have to have income of under $1,200 a month. For the SSI, what you need to do is once you qualify for SSI, you get Medicaid. And what you need to do is you have to have income less than $1,200 a month, and you have to have assets less than $2,000. So it's important, and we're going to talk about that $2,000 limit because it's a trap a lot of people fall into. So when you go apply for SSI at age 18, you need to be sure that your children don't have more than $2,000 in their name. So a lot of times people have bar mitzvah money, they have communion money, birthday money, they have accounts they've set up, maybe college accounts they've set up for their special needs child. And sometimes that money has grown over the years. What I encourage you, before you go apply for SSI, before you go into Social Security, because they're going to want to see bank statements, savings bonds are another big trap. People have them, they got them all these birthdays, they forget about them. And what happens is, it turns out they, age 18, they get ready to go in, they look and they go, there's more than $2,000 in their name. So you want to be sure, it's critical to get qualified for benefits, that prior to application at age 18, if there's money in their name, you need to have them spend that down. If it's a little bit over, it's easy to spend down. If it's a lot over, you need to call me. I can tell you about legitimate ways to spend it down. Legitimate means legal ways to spend it down. But it's critical. So at this point, depending on the age of your child, if there is money, try and get it out of their name. All right. So for SSI, supplemental security income, what is countable income? So the reason I put this slide up is I have a lot of people telling me, yeah, my son or daughter has a job at Wegmans or ShopRite, and they were a couple of days a week, but then they got a promotion, and now they're going to work on a couple of more days, but I didn't want them to do it because I read on the Social Security website they can't have income of more than $1,200 a month. Well, the answer is there's a couple of things that sometimes you don't read in the fine print. And when they're looking at that SGA, substantial gainful employment, they're saying earned income of over $1,200. They only count half of your earned income. So if you're earning $1,000, okay, they're only counting $500 towards that. Of your salary and wages is what they're counting, just half of that. So a lot of people are unaware of that, and they needlessly have their children staying home when they could be out working because they're unaware of that limitation. What they do is they count all unearned income. All unearned income is income that comes from interest and things like that, but our children typically don't fall into a problem with that, okay? But that's Social Security benefits. So if a parent retires, there becomes a little problem, unemployment, interest, and things like that. Now, this is something that's really important, and it's overlooked all the time. They count in-kind income. So in-kind income, what is in-kind income? In-kind income is when we give our children something that has value and we don't charge them for it. For one, that would be rent. All right, so when we go and apply for SSI and we walk in and I show the Social Security agent, here's my daughter's bank account and she has $700. Okay, they check the box under $2,000. What's her earned income? Well, She's still in school because she's 18. So let's assume your child's in Yale. She's still in school. There's no earned income. What about unearned income? No, no other benefits. And then they go, okay, where does she live? She lives at home with me. When you get home and you come back from that appointment, about 2 months later, you're going to get a letter from Social Security and saying your benefit was reduced because of in-kind income. And you're going to go, what was the in-kind income? And it was the free room and board you gave her or him. So we're going to talk about how you navigate around that in-kind income using rent. All right, so that's food and shelter. Okay, so countable income reduces your benefit. All right, so let's talk about why apply for SSI now. So, because some people say, well, I'm not sure, you know, my son or daughter are doing good. They're doing great in this work program. I don't know if we're going to need it. What I would tell you is this, great, I hope they don't need it. But what I can tell you is when you at age 18, when you apply for SSI, it's an easy process. They look at the IEP, they look at their in school, and they almost go ahead without problem and approve it. When a child has gone 5 or 6 years and now they're in their 20s and all of a sudden you find out, you know, they're not making it in the job, they're struggling maintaining employment, and now you go back and apply for SSI, it's a much more difficult path because they're saying, wait a minute, they lasted 5 years without it. Why do they need it now? So you want to apply now. As soon as they turn age 18, you call Social Security up, schedule your appointment. You're going to walk in with your IEP. They're going to get information from your doctor. So, and the process is they're going to tell you they want forms from a psychologist, which they'll send you to. And we did that process, but they're going to want forms from your doctor. Let me give you a caution on that. When the doctor fills out the forms, they're busy people. Don't just drop off those forms without some coaching. Let the doctor know. Say, listen, I have these forms for my daughter or my son. I'd appreciate if you would fill these out. These are for her to apply for government benefits. So when you're answering the questions, please don't be over generous in her capabilities, because doctors are trying to be nice. Oh yeah, Kelsey can do that. They can do that. And the next thing you know, you're denied SSI. So do not just drop off the forms at the doctor's office and have them send them in without you looking at them, and coach the doctor that you need an accurate assessment of your child, not an optimistic one. Sometimes their good intentions can thwart you getting your benefits. All right. So why do you apply now? You apply now because it's the lowest income period. Our children are 18, right? They're still in school. Most of our children may not graduate till they're 21. Some may graduate at age 18, but at age 18, they're in a lowest income period. So we want to get them in because they can qualify easily now. So what you'll find is, remember I told you that it's $1,200 is the earned income credit, is the amount of income, substantial gainful employment. Do you remember years ago when they said, we have this problem where all these people on welfare and we want to get them off because it's costing us too much? So what would happen is people would keep their income down because they knew if they went over a certain amount, they would lose all their benefits. So the government said, we got to come up with a better way. So the better way is they build a runway and they say, once you qualify for benefits, once you qualify for the first month, you got to get that first month. After that, if your income increases, you can still keep your benefits. Your check will be reduced, but you can keep your benefits. And actually, in the state of New Jersey this year, if you qualified for SSI that first month, you could have your income continue to increase and you could earn up to $35,000 a year and still be eligible for Medicaid and SSI and all the benefits our children need. So people aren't aware of that. So again, you want to qualify now. If your son or daughter is successful and continues to be able to get gainful employment, great. You can still get earned income up to $35,000 a year and keep your benefits. All right. Now you get to a certain point, you're not going to get any check anymore from the government when you go above 35. but you'll still get Medicaid eligibility. And Medicaid eligibility is those services in the future that could provide residential and a variety of supports. Okay. All right, so let me shift gears here. Let me just share with you one thing. If you do apply for SSI and you get denied, you have 60 days to appeal, and it has to be a written appeal. So let me just share with you. It's if you go 61 days, it doesn't matter what the reason is. If you have not filed a written appeal, not a phone call, not I disagree with this, don't let that letter sit on your desk. At the end of 60 days, if you have not appealed, it doesn't matter if you were right or not. You're not getting a hearing. You're going to have to get an attorney, and you're going to spend a ton of money trying to get through the door again. So if you do apply and you get denied, if you have a 60-day window to appeal right away, do it in writing, get a certified letter when you drop it off. All right. So now we're going to walk through benefits. So we're going to do some arithmetic. So I want you to take out a piece of paper and write down, just write these numbers down so the next few slides will make sense. Every year if your birthday's in January like mine is, in July on the 6-month anniversary of your birthday, we get a Social Security statement. And most of us throw it in the trash, but it tells you what your benefits are. And on there, it has your retirement benefits. So we're going to use this sample family where we have a dad and he gets his statement and it says his retirement benefit is $2,000. And then it says, let's assume in this family, we have a spouse that doesn't work outside the home. The spousal benefit is 50% of the father's benefit, and that would be $1,000. And then there's a family benefit on that statement. So when you get it next time, look at it. And there's a family benefit, and it says that's $3,600, and that comes every year to us. So let's walk through that statement, and I'm going to walk you through how the benefits flow. All right, summary of benefits. So let's go through the different stages. The first stage is our child is under age 18, living with us, and the parents are still working. So what happens there? Well, it's an entitlement benefit. We have education. It's free and appropriate up until age 22. That's what we get. Now, parents' income and assets are deemed to the child. So if your income and assets are substantial, not substantial, if they're just average, there's no benefits. There's no SSI. Now, if you're as a parent, if you're in a low income, and you fall under certain income levels, your children may apply for Social Security. But what they do is they look at the parent's income and assets. So most people, there's no SSI at that stage. Now we go to the next stage. Child turns 18. Parents are still working. All right, now what do? Well, we immediately call Social Security and we apply, and we won't let them know we want to apply. When you make that phone call, they're going to give you a date. And that date may be 2 weeks, maybe a month and a half out. But once you get approved, they will pay you back to the date of that phone call. So I would tell you the day after your child turns age 18, you call Social Security. Now, what happens? I walked in with my daughter. We applied for Social Security. She gets a check for $771 a month. What else does she get? She gets a card that says she now has Medicaid. All right, Medicaid is the backup insurance. Now I'm still working. My daughter is still on my plan because in New Jersey, for most plans, you can keep a special needs child on your plan after age 26. I keep her on my plan because my insurance is better than Medicaid. But sooner or later, I'm going to retire and I'm not going to have my plan. And now she's going to need that Medicaid. So I have that Medicaid as my backup insurance right now. Then but remember, I have an asset limit. When I went in, my asset limit had to be under $2,000. I was able to be sure Kelsey didn't have more than $2,000 in her name. And I said, nope, she just graduated from the Kingsway Learning Center. And or as a matter of fact, she was age 18 when we did it. She's still in Kingsway. She has no income. So we qualified. Okay. Now, let me give you a little story. Remember I told you about we can't have more than $2,000? Well, if your child's getting a check for $771 a month, and if my daughter spends it on pizza and sushi, and maybe she goes to buy some sundries at one of the shops when things were open, it's hard to spend down $771 a month. And the problem is if she gets more than $2,000 in her name, we got a problem, right? Because they're monitoring that. You go in for audits every once in a while. So remember I talked to you about in-kind income? So what I encourage everyone to do is you need to have a mechanism to protect for that problem. And one is charging your child rent. So when I went into Social Security, I explained to the Social Security agent, he says, where does she live? I said, she lives with us, but she will pay rent as soon as she turns 18, just like her brother. And by the way, sir, here is the lease that Kelsey signed. And I have a 2-page lease. If anybody needs it, email it to me. I'll give it to you. It's a room and board agreement. It's real simple. It says that Kelsey's going to pay $650 of rent for live in our house and receive and get meal, room and board. And now what happens is 2 things happened. Number one, my check was not reduced at all for any unearned or in-kind income because I wasn't giving her anything with no cost. We were charging her, so we were able to get the full check amount. But secondly, and most importantly, when that check would come in every single month, and I have it simplified. My daughter has a debit card from TD Bank. The Social Security check goes into there. She takes me out to lunch a couple of times a month, spends that, and then the check comes in on the 1st of the month. On the 5th of the month, the rent check comes out and goes into an account I have set up. And that money goes into an account, and it's been going in there every single month. And at my passing, that check will, that account will be there available for her special needs trust. So again, it's a key nuance, but setting up that rental agreement is key. It maximizes the check and it ensures that you don't go above the 2,000 limit later. All right. Now, stage 3, parent retires with a Social Security work record. Remember I gave you those numbers to write down earlier? Now here comes the quiz. So now what happens is, let's assume I retire. I'm going to get a $2,000 retirement check. But now that I've retired and I qualify for Social Security, what happens is my daughter and my wife gets a check, okay? Because remember we had a $3,600 limit. I retire. My wife and my daughter split the remaining family benefit, which is $1,600. $800 goes to my wife and $800 goes to my daughter under my Social Security benefit. Okay, so this is important. So as we age out and retire, now I work with a lot of families and people that don't have special needs children. And for years, a lot of those clients go, you know, I can take my Social Security age 66, or I could wait till 70 and get a bigger benefit. Well, that makes sense if you have a typical family, but if you have a special needs adult, sometimes delaying taking Social Security doesn't make sense because your special needs adult child will also get a benefit as soon as you start collecting. So here, I've retired, I get my $2,000, my make-believe spouse here has gotten $800, and the special needs child gets $800. All right, now what happens? Okay, well, my SSI goes away. You don't get both. You just get, you never go down, but you don't get both. So all I get is the 800 a month Social Security benefit the child gets under the parent's Social Security record. Now what happens? I still have Medicaid. I still keep Medicaid, but I still have an asset limit of $2,000 and I have an income limit. But what happens is 2 years later, 2 years after I've collected my Social Security benefit, I'm getting Medicare. My child is still on Medicaid, but 2 years later, what happens is there's a 2-year wait. What happens is my child, my adult child with special needs, qualifies not for Medicaid, for Medicare, which is hugely important because Medicare pays more, and by virtue that it pays more, it is much higher quality than Medicaid payments. And you'll find lots of doctors, when you say I got Medicaid, they go, we're not taking anybody with Medicaid. Medicare, they'll take you. So you want Medicare. All right. And I'm sorry to make, I know this is complicated, but it's important you know this because people get lost in this timeline and lose benefits. All right, so 2 years later, my child's getting 800, the retired parent's getting 2,000, and the spouse is getting 800. And then what happens? Let's assume in my fictional family here, the dad passes away. Now what happens? The dad passes away, the spouse steps in to receive the earned income spouse's benefit. So in this, my fictional spouse, she receives the $2,000 a month that the retired father was receiving. The daughter, the special needs daughter, now steps in and gets the balance of the family benefit. Remember we said it was $3,600? The spouse is getting 2,000. The special needs adult child now is getting $1,600 a month and getting Medicare. So that's a timeline of how benefits work. At this point, I want you to see the end game just so you know it. And if you're approaching retirement and collecting Social Security benefits, reach out to me. It's a critical time. But the most important thing is you get your child qualified for SSI Now. Keep the income below $2,000. I'm sorry, keep the assets below $2,000. Income shouldn't be a problem. And remember, when you walk into that Social Security agent, have a lease with you that says they're going to pay rent. So you get the full benefit and you can avoid a problem in the future. Okay, and actually the true story on that is I went in with the lease, showed them the lease, said my daughter's going to be paying rent, $650 a month. Here it is. Walked out. A month and a half later, got a letter from Social Security saying, hey, you didn't, your check is not for the full amount. We're reducing it to $500 because your daughter's receiving unearned income, in-kind income. So you can't call them up and fix it. You're just getting this big line. And this is back before COVID. So I had to call up, make an appointment, get me and Kelsey, go down there, bring the lease in. And what I did is I showed them the lease. And now, and let me, I don't know how to say this tactfully. When you go to Social Security, I want you to be aware of something. There's three kinds of people. There's some people in Social Security there that are, it's a tough place to work. It's a government bureaucracy, and sometimes it's a very difficult place to work for a lot of people. So some people are there just counting. They know exactly how many days and years they have to retirement, and they're just looking for that. There's some people there that somehow think this money is their money. And if they don't give it to you, then they have more or something, or they're doing a better job by keeping people from getting their benefits. So they're trying to catch you making a mistake. And then there's some people who are angels. And my mother, when she walked in and she was trying to get benefits from my brothers, and she answered a question, the woman goes, you know, Mrs. Byrne, let me give you a better way to frame that. Maybe if you did it this way. My mother was, oh, thank you. And she answered it that way. It wasn't changing the core of the question, but it was changing how the answer would be framed. And because of that, my brothers were able to get the benefits they deserved. But you don't know which of those three people you're getting. Okay, so you need to be aware. Just answer the question they have. Don't volunteer anything else. But in my case, I had to go back in, and I went in and I showed them the lease. I said, I don't know why I got this letter. It says being denied the full benefit because of in-kind income. I showed him the lease, and the guy looked at me and he said, I apologize. We have a lot of people here that kind of struggle with understanding how these benefits work. Let me fix that. And typed into his computer, you know, and a month later, we got a check for all the back months. but sometimes it can be a difficult process going through the system. You have to go in there for audits occasionally. They're going to want to see bank statements. Just package everything up, be polite, answer the questions, and you'll do fine. All right. This is difficult virtual because usually I'm looking at the space and I can see people's faces in there. But I hope you're all appreciating this. And again, if you have questions, maybe I should stop at this point and
Mike,
ask if
thank
there's any
you.
questions.
Because we do have a good question here from Michelle Tyler. Michelle asked, why does she hear from families, and including her own, that SSI is $573.65? She's asking, does she need a lease to increase that?
Yes. So if she's getting $500, that's because if you read the letter, that when you got your benefit, they're saying that's exactly what happened. Her deduction is correct. What they're doing is because she didn't say her son or daughter was paying rent, they're assuming that they have in-kind income, and they're reducing her check from $750 down to $530 because of the she's not paying rent.
So I'm
but-
sorry, can I ask?
but you
So
can go-
then I would just need a lease for a certain a dollar amount. What dollar amount would I have to put for his rent, or is there a certain dollar amount?
Yeah, so what the lease has to be, it has to be what they call fair market value for that area. So what I can just tell you this, Voorhees, Marlton, Cherry Hill, Collingswood, if you put down $650 a month for someone to live in your home and you feed them 3 meals a day, I would think that would be fair market value. That's the number I've used. I haven't done any analysis, but I think that's a fair number, and that will get you what you need, because if you get a check for $750 and you're taking out $650 for rent, that's $100 left every month for your son or daughter to spend to buy you pizza each week. I think you're good.
Okay, and did you mention that you would share the 2-page lease that you have used?
Yes. So at the conclusion of this, I'll leave it up there. I'm going to put you my email address. Just send me an email and say, hey, send me the room and board agreement or send me the lease, and you can just use it. I've used it for my brothers. I use it for my wife. And I think there's probably 100 people in the system using the same exact lease. So not a problem at all.
Thank you so much. Appreciate
Okay.
that.
And you'll
Mike,
have to go back to Social Security and say, I want to come back in, and just let them know, hey, my daughter's paying rent now and here's the lease.
Okay, thank
Okay.
you.
Mike, there's another question in the chat, and it has to do with, does your daughter have a special kind of bank account?
A special kind of what?
Bank account?
My daughter we went to TD Bank when she was, I don't know, she was probably 16 or something. And we opened up a bank account for her with a debit card. So I guess it's a checking account technically. We opened up a bank account. Now I'm on the account. All right, so I'm on the account. They can't tap into my money. It's in her name. It's her Social Security number, but it was like a student account we set up. So I'm on the account. So what happens is her Social Security comes into that account. Now, this is a great question, because my daughter, she's great. Her personality, effervescent. Can she read? Great. She loves to read. Can she do math? Not a lick of math. So with money, she has a very difficult time. So before, when she had her wallet and she would go to the mall with her friend, and I'd be, hovering, 50 yards behind, and they'd go into a store, when they get done at the end of the day, and I'm like, what happened to your money? Well, I bought a pizza and I bought this. And I had no track, like the pizza guy charged her $20 for a slice because, So what I did is I gave her a debit card. And now she goes in with a debit card. So I'll give you a short example. We went on Haddon Avenue, went to a restaurant, and all of a sudden she comes back with her girlfriend, and I look at the debit card because I can go online and see it because I have access to it. And I'm like, what do you mean $50? They went to get a couple of tacos. So I go pull the bill, and I walk into the manager and I go, look, how's this? There's a $30 tip on a $20 bill. but because I had the debit card, I had everything there I could show them. So I would encourage you, get debit cards for your son or daughters. I can go on every night. I can see what she's spending. Now she only has a couple $100 in there, so she can't get hit hard, but it allows me to watch what she's spending, help her with her money. So that's one thing. We use that debit card. It's linked. I can see it. The second thing I'll tell you that I did for my daughter is I got her a tip calculator on her smartphone. So she puts in when we go out to lunch, she puts in the bill, then she puts in 20% tip, and it tells her exactly how much to write out on the receipt. It does all the math for her. It's a little app you can get for nothing on your iPhone.
We have a parent who has a savings account in her name, the parent's name, and she is asking if her child is named on that account as a
Actually-
beneficiary. Does that count as income?
Actually, it's like similar to a 504 account. I typed it in wrong. It's a college savings account, but like a 504.
Okay.
Okay,
Similar to a 504. I think it's called something else.
so it's
ESA.
is it a 529 account? That's the number.
I mean,
they-
529. That's the one I mean.
Yeah.
529, but it's not a it's an ESA, I think.
Okay. Send me an email on that. That's a separate thing. It's a very unique thing. So send that to me on the account and I'll give you the advice on that.
Okay.
Okay, but yes, how old is your child?
You're 17, but they'll be 18 in a couple
All right,
months.
so send that to me this week so we can address that.
All right. Thank you. Appreciate that.
Yep.
Does a whole life insurance policy affect assets? Another question.
A whole life, so typically if the child's the insured, no, it does not. It's the owner of the policy that could affect them. So if the child owns the policy, but rarely would a special needs child ever own a policy. Usually the parents own it. The parents are the beneficiary, the child's the insured. But if a child did own a whole life policy, technically that would be considered an asset. And if the cash value of that policy was over $2,000, it would deny them benefits. Now, the practicality side is there's no 1099s, there's no reporting on insurance policies. So not until a death occurred would anybody ever see that policy unless it was self-reported. I'm not suggesting you hide it, but again, check who the owner is on the policy and then email me and I can give you proper guidance.
The next question is about special needs trust, which I know that you'll be getting into, but we may want to hold the question. Does a special needs trust have an impact on the $2,000 in your child's name?
We're going to hold that question because we're going to cover that next.
Yes.
Okay. Are we good to go forward?
Does anyone else have a question? I do see one here, but I'm not quite clear if it's, is it from Mr. Lazowski? Anyone want to jump in on a question about insurance other than the one I just posed?
I had a,
Sorry, go ahead.
I had a question on listing your child as a beneficiary in general. I mean, is that not a good idea because it could be seen as an asset, whether it's a pension, whether it's a insurance policy or.
Jerry, absolutely, you're right on target. We're going to talk about that in a few minutes when we get to the special needs trust, but the answer is no, you don't want your child to be listed as a beneficiary.
Okay.
I have one SSI question.
Okay.
If my children are already getting SSI since they were little, just for medical benefits only, do I have to redo all that at 18 years plus 1 day, or how does that work? Because they're already getting SSI.
I don't know the answer to that, but I would double check that and I would be sure that once they hit age 18, be sure they still don't have $2,000 in their name.
Okay, thank you.
Okay.
I think we're good now, Mike.
Okay.
Oh, no,
Great.
but sorry, I had one other question.
Okay.
And I had posted it there. So our son, his grandmother started buying him stocks and it's in her name and his name. So obviously they would count as income, correct?
Yes.
And would the suggestion at this point be to take his name off of them?
So here's the answer. The answer is yes. So that's a typical problem. A grandparent, as well-meaning as they are, says, let me buy some stocks together. Now, if it's a joint account, and it really depends on whose social security number is linked to it. But if it's her intention to say, I'm buying these stocks and they're for him, she would want to buy those in the name of the special needs trust.
Okay, once we get a special needs trust set up, that's who she would buy it in.
Yep.
Okay.
Okay.
No, right now it's her social with him as one of the names on it.
Yeah.
So
So
we
if
need
it's,
to get his name off.
yeah, if I would get his name off, it's in her social. And then if she says, well, I really want to give this to him, no matter what, then I would just buy it in the name of the special needs trust.
Perfect. Thank you.
Okay. All right. Couple of other things. Just, are we good on questions? All right. I'm going to take the silence as a yes. So just a couple of other things on benefits. Sometimes people are unfamiliar. Their child has qualified for SSI and is getting benefits, and then all of a sudden starts to do well on the job and now is working 40 hours a week at Wegmans or at ShopRite, and their earned income has gone up. Do they lose their Medicaid benefits? Do they lose their eligibility for residential supports? All those things that DDD provides? And the answer is no. There's a special program called Workability, and there's an office in Voorhees that does this. And when I talk to them, they go, please spread the word. People don't know about this. But Workability is for disabled special needs adults under age 65 years old. And you can have unearned income of $1,000 a month. You can have earned income of $60,000 a year. You can have $20,000 of assets. And it doesn't include your IRA and 401k accounts. Now, this is important because remember I talked about the example I illuminated was Wegmans and ShopRite. Some of those places have retirement plans, and all of a sudden our kids can't have more than $2,000 in their name, and all of a sudden they do because this money's going into this retirement plan as a byproduct of their employment. So not a problem. That's fine. If we have if one of our children is earning good money like that, great. But how do we keep them eligible for benefits in the future? We apply for under Workability, and they get an exemption. They keep their DDD benefits. They keep their eligibility for residential supports. They keep their Medicaid coverage. They get full Medicaid benefits. But if they want the Medicaid benefits, they got to pay a $25 a month premium, which is fine. So just be aware of that. So, because I have some people saying, well, I don't want my child to make any more money. They're going to lose their benefits. And that's not the case with Workability. All right. Now, let me, we're going to talk a little bit about what's going on. Remember, I illuminated earlier that 10 years ago, when our children graduated, basically there was this program or that program, take it or leave it. Here they are. Now it's a fee for service model. And what they're doing is you get a budget based on the needs assessment. So we talked about the needs assessment. You want to do that assessment, and then they're going to assign you a budget. And then that budget, then you craft a plan. You get an independent support coordinator. That coordinator, when you're looking for someone that says, well, I want them to get involved in a recreation program or an art program, or I want them to get some job training, or I want them to get this, that support coordinator can point you to the available sources and give you help with that. You as the parent, kind of view this as before you used to go to someone and say, build me a house. Now what it is we get to self-manage with the help of a support coordinator. So you become the general contractor. And now what you get to do is you're going to say, I'm going to hire this person or I'm going to hire that person. But here's the beauty of it. Now we got this budget, we get this plan, and if we get somebody in there that's doing recreational with our son or daughter and they're just not doing a good job or they're not connecting, we can fire them and we can hire another one. You can get family members approved if they want to go through the training. But you can customize a plan now and you get a menu of services and fees that are available to pay those people. So it's a much better model now. But as parents, before we just kind of took one place and it was done, and it was either done bad or done good. Most of the time it was done mediocre to bad because there was no ability to hire and fire. Now with the ability to hire and fire, it causes people to have quality in their programs. So we're on a fee for service model now. Once your children graduate, you're going to get that budget and you're going to be able to build them a program. And it's out of that budget that pays my daughter's Uber bill every month when she goes back and forth to work. So some great things coming out of that. We're going to talk about, you get community support, personal care assistance I talked about, you get transportation. There's, for some of our children who don't have the capacity to go to work, there's day programs. Now you can go check out a day program, and if it works, great. If not, you can take them out and put them in another one. So you have full control. You get supportive employment with this new program that you can craft. You get assistive technology for our children that need technology, whether it be in the computer area and assisted technology because of physical limitations. All those things can come out of that budget. So we get to craft these plans that are customized for our children. All right. All right. Now, before I get into wills and trusts, we're going to do one other item. I want to give you an update on housing. Housing's the big thing. Right? Big question. What happens when I'm no longer here is where's my child going to live? And the issue is this. There's 10,000 people on the waiting list in New Jersey to get housing. And right now it's emergency placement. So when one person, and you only get on the emergency list, you only get on the expedited list once both parents, I think, are over 60, and you get on the emergency list when one parent dies and the other one's close, then you get on the emergency list. And then what happens is our children get placed, right? So the reality is this, 10,000 people on the list, it's all emergency placements. The only people that are getting placed is when parents are dying off or a child is a risk to other people in the household because of behavior. They're the only people getting placed right now. So as parents, we need to say, we got a huge waiting list. It's only emergency placements. And then let's look at the reality. The reality is New Jersey, from a fiscal perspective, is in trouble. They got huge budgets. They got huge pension obligations. They got people leaving the state. Now we got this pandemic expense. So let's not delude ourselves and think that if we get a governor or a representative in there that wants to benefit special needs, that all of a sudden we're going to get this budget that's going to allow for housing. Because we have one of the more powerful people in New Jersey now, Steve Sweeney, with a special needs daughter. He's been a great advocate for us, but there's only so much money. So there is lack of funding and lack of choice. Okay. And that's not going to change. So what I would encourage you to is look for creative options. All right. So where are we going? So residential options. There's 4 basically different paths. One is group homes. So for children that have severe needs, there's group homes, and those are provider agencies will provide them. The ARC, different people have those type of programs. JCC is launched a beautiful program out on Springdale Road where they built a community they got some low-income housing vouchers and they did some creative financing. The guy that did it there, who has a special needs son, but it's a beautiful community where they have these quad units, and 3 out of 4 units are retired and 1 out of 4 is special needs. So that would be a community care type program or a group home type program. There's supervised apartments. I have a client who has his son in a supervised apartment, again, like the JCC is doing there. And there you have these apartments. You can have healthcare nearby, but people checking on them daily in those supervised apartments, 24-hour support. You have supportive housing. I mentioned my brother. My brother lives in it's a one-room efficiency in Morristown, up in North Jersey, but he absolutely loves it. It's his own place. He goes, and it's his homestead. But supportive housing, and the supportive housing comes by every week. They help him with cooking. They help him work his iPad. They help him with be sure he has his food, helping him with his checkbook. So a lot of different things. Matter of fact, that's my brother now calling. Supportive housing is another option. Okay. And there's budgets for that. Now, New Jersey has vouchers now. They're giving vouchers for supportive type housing, where they'll give you a voucher. It's worth about $900 for a single apartment. And you can go get one of those apartments and you can lease or own those. And they have as needed services. There's community care homes. We're not going to get into those. They're not used much, but it's where someone goes into a home with another family and they lease out space. And then there's independent living programs. So these are programs, and there's some innovative ones that have come up. And there's one now, and I'm trying to find it right here, but I can't seem to get it. But there's one that was launched, and I wanted to show you the slide, but I can't. Maybe I can do that. Hold on, stay with me. It's a beautiful slide. Oh, here it comes. I'm going to slide it over. Okay. So here, what we have is an independent living program. It started in Collingswood. Remember I told you my daughter was 4 blocks away. I used to live in Marlton. The reason I moved to Collingswood is this way I could be in town near her and run into her. But right now we started off with about 8 kids. They're all sitting in front of the fountain in Collingswood. They're all special needs, all living here. And now we're up to 28. And what they do is Jewish Employment Vocational Services is a sponsor. They use the DD. Remember that budget I talked to you about? They're using that DDD budget. Every one of those kids in that picture are living in their own apartment. They're getting a housing voucher. And then Jevs is coming in and providing the services. So they come in and teach them how to cook, how to clean, how to navigate the town safely, how to get on the speed line. So these are the types of programs that are available. So when it comes to housing, it is about innovation. Because with the budgets right now in New Jersey, it is very, very limited. So if anybody wants any information on this program, let me know. There's a sister program like this in Narberth. So, all right, that's housing. All right, benefits. In addition to government supports, as you all know, there's recreation programs, there's ARC programs, there's I didn't realize it, but the Elks Club, they sponsor a camp up in North Jersey for free for special needs adults. There's all kinds of programs, Special Olympics. So it's all those tools as parents we need to dig into and utilize. So as you can see, it is complicated, especially when you get into those government benefits, but reach out to me on that. I can be of assistance. You need some knowledge. You need a lot of patience. I'm going to tell you, you may be going to Social Security multiple times saying the same thing. Just be polite and be persistent and determined. And you'll get the things you need. And the other thing I'm going to tell you, I shared with you what the rules are now. I've watched my mom, who's 90, navigate these rules for, I don't know, 30 years, and they keep changing. So they'll keep changing. All right. Now we're going to get to the legal options. All right, how do we protect those benefits? All right, so when my dad, as he aged and he was getting older, he said, Michael, listen, I got a problem. I got 2 special needs sons here. And if I put anything in their name over $2,000, they're going to lose their benefits. So what should I do? Now, a lot of people get overwhelmed, and not just people with special needs. I'm talking about people. Only 50% of the people in this country have a will because they get overwhelmed. It's unpleasant to think about. So let's not do anything. And that's a terrible approach, because if you don't do anything, the state of New Jersey has a will for you. And it says 50,000 is going to your spouse, and the rest of the assets are split between spouse and children. And if you happen to have a special needs adult and they get more than $2,000, they now have just lost all their benefits. So do nothing isn't working. The second thing is I have families go, well, you know, I love my children equally, so I'm just going to leave equal to all my children because I love them equally. Well, I got to tell you what, I love my children equally too. But at the same time, God gave my son different gifts than he gave my daughter. And as a parent, my responsibility is also to give different benefits and different supports to my son versus my daughter. So equal to all, although that's a simple approach, simple usually isn't the best, and that doesn't work. So then my father said, hey, I'll tell you what I'm going to do, Michael. And this is what a lot of families do. They say, Michael, you seem to be a pretty responsible guy. So here's what I'm going to do. I'm going to leave Billy and Chris out of the trust or out of my will. And I'm just going to leave my assets to you when me and your mother pass away. And then you be sure to take care of Billy and Chris. The problem is that scenario has a problem. One is that I don't think disinherit spelled right, but anyway, that has a problem that I've seen lots of good people go bad. Bad things happen. I've seen good people get gambling problems. I've seen good people all of a sudden have a marriage problem and now there's a divorce and we're splitting all the assets, including the assets that my father left to me from my brothers. Or we see I get in an automobile accident and there's a tragedy and a lawyer goes, wait a minute, let me see the assets this guy has. Wait a minute, he's got all these assets. Let's go get those. And all of a sudden my brother's assets are gone. So these strategies are terrible strategies, but they're used. The best strategy is a trust, to use a trust. Now here's the problem with a trust. The problem with a trust is one thing, perception. Everybody thinks of a trust as the Rockefellers and the Kennedys. They do trust, but that's not the case. A special needs trust is just another way to hold assets. So what is a trust? It's a way of holding assets. So my trust is simple. I go to a special needs attorney, and I'm going to say that again, an attorney that does special needs. Do not get this drawn up by someone who does real estate closings, accidents, or not a general practitioner, because when you do a trust, you never know if it's done wrong till it's too late. So you go to an attorney that knows how to do this. I know the Yale School has an affiliation with Pryor, Henkels and Pryor. I've used that firm. My mother uses them. They're a great firm, but there's lots of great firms that do special needs. So if you need recommendations, I can give you 3 or 4 names that do it responsibly and reasonably. So a special needs trust, and my trust says Michael Byrne, trustee of the Kelsey Byrne Discretionary Special Needs Trust. And that's how it's set up. Simple trust, not a bank, not the Rockefellers. Now, how does that trust work? So instead of leaving money to my child directly, what I do is I leave money into that special needs trust. So we were talking earlier about the woman that had a grandparent that said, I have these stocks and I want my son to own them. Well, don't put them in your son's name, put them in the special needs trust. So my will says at my passing, everything goes to my wife. At my wife's passing, everything that remains goes split, and a big portion goes to my daughter and another portion goes to my son. Now let's talk about the portions. The portions are tough. People go, how much will I need? My view is this. I gave my son a college education. He's been blessed with gifts, and what I'm going to do is put the majority of the assets in the special needs trust. And what I'll do is I'll give him some, but I'm going to put the biggest safety net in the special needs trust. And I'm going to show you why in a minute, because there's a safety net or a back door on it. So I have this special needs trust. Now, how does it work? At my passing and my wife's passing, money falls into the discretionary special needs trust. In the beginning, I had my partner as the trustee at my passing, but it could be my son. Now he's responsible. He's almost 30. He'll become the trustee on it. What does that trust pay for? At my passing and my wife's passing, it pays for supplemental care. Supplemental care could be dental. It could be internet access. It could be recreation. All the things the government won't pay for is what it pays for. And then at my daughter's passing, whatever remains in that trust, this is the trap door, the back door, goes to my son. So by doing that, when people say, I just don't know how much to put in a special needs trust, I'm like, overfund it, because whatever's left over in the end is going to pass to your other children anyway. But don't risk underfunding the special needs trust. Okay. Now, two things. Who can set this up? It can be set up by parents. It can be set up by siblings, and grandparents just can't be set up by the beneficiary. So I encourage you, but set that special needs trust up now. People say, well, I'll wait to do it. What happens is sometimes there's other family members, and we've had this happen, where a grandparent passes away, and unbeknownst to anybody, in the will it says, I leave, $10,000 to my special needs grandchild. And all of a sudden the grandchild gets this money and now loses all their benefits because they got more than $2,000 in their name. So what I tell people is set up the trust now. And what we tell our clients to do is we send a letter out, and the letter goes to all the family members. And the letter is worded something like this. It says, listen, this is not a request for you to leave money to our daughter, Kelsey, but we just want to inform you, if it were your intention to do that, please do not leave it to her directly. It could jeopardize her benefits. Leave it to the Special Needs Trust dated June 1st, 2021. And that's what it does. Now, the benefit of that letter, it's interesting what happens. It's just to prevent someone leaving money to the wrong place. A lot of family members, we've had family members call up the family members that sent the letter and go, I'm so glad you sent this letter. I've wanted to do something, but I felt awkward bringing it up. So I'm so glad you sent this letter. But it's important to let family members know about this trust so they don't inadvertently, by their good hearts and good nature, leave money directly to your special needs child. So set that up, an important piece, and let everybody know in the family about it. Things to know about this trust. Who's in charge of it? It's not the Bank of America. It's not a law firm. You're in charge of it. You run the trust. I'm the trustee of my daughter's trust. There's no money in there, but for my brother's trust, I'm the trustee of it. And when they need money, I help them buy an iPad with it, and I help them buy stuff. And at the end of the year, I take the investment statement, I give it to the accountant, and we file a tax return. And it's pretty easy work. Okay. When do you create it? Again, you create it now. And you create it now for two reasons. One is I talked about piggybacking. It allows grandparents and other family members to leave money to the special needs trust. The other reason you do it now is it's a grandfathering. And by that, I mean, right now, the rules are great on special needs trust. You can leave money there. They get all their government benefits. It doesn't affect benefits whatsoever. But if they change the rules, they usually grandfather things when it comes to trust and say, from this date forward, we're changing the rules. Right now, the rules are great with these trusts. So I encourage you, create it now. In the event of another family member wants to leave money, it's there. All right. Funding the trust. What do you fund it with? Well, you fund it with life. A lot of people use life insurance to fund it with. Sometimes people will use their retirement benefits. Some people will have their home. Their home will be sold, will go into the trust. Cash and investments. So they're all different tools. It's important that that trust be there, and there's a mechanism there and trustees in place for that trust. But it is the trust that allows you to leave that safety net, that financial safety net. In our trust, I have it set up where I have a provision in that trust, and you can put that in there. And so I told my son, I said, listen, here's a key thing to remember. And people ask me this a lot, and I forget to mention it. Remember this: nothing goes into that trust until the second person has passed away. So people say, well, should I put money in that trust now? I'm like, no, because with a trust, there's certain rules what it can be used for. But when the money's in your name, the money's in my name, I can do anything I want for my daughter with that money. I can take her on a trip here. I can spend it on anything. I have no rules. The trust, you don't fund it now. It's there to be funded at your passing or the death of another family member that wants to leave a bequest. So just some important things on the trust. There was one other point I wanted to mention. It'll come back to me. So that trust is critical. What if the child receives money? I'm going to briefly talk about this. There's a OBRA 93 trust, or it's called a payback trust. And this happens when a child is awarded a legal settlement because of a medical malpractice, is a common occurrence. That money is not yours, that's technically the child's. The way that works, same as this, money there can go into this payback trust. Because remember, if that, lots of times people get these medical awards and then at age 18, it's their money. And now all of a sudden they can't get SSI. So you can set up this trust. You can take that award money from medical malpractice, put it into this payback trust. It works just like the other one. It pays for supplemental care, but, big but, at the child's passing, the state gets reimbursed for any Medicare benefits it paid. And then the remainder goes to heirs. Okay, so special needs trust, you got to have that in place. Oh, I know what I wanted to talk to you about. So I put a clause in mine. And I said, I just want to make you aware of another organization. I said, okay, so what happens? I got my son as the trustee. My daughter's living here in Collingswood. She's kind of ingrained into the thing, but needs some oversight. And we're working with Jevs and they're doing a great job. But now I'm gone and my wife's gone. What's my safety net? And here's the problem. And let's assume my son is like many in the world today, and he's living in San Jose or Dallas or something, and with his family. And even though his intentions are good, he can't really have oversight of his sister and check on her care. So what I've done is there's a organization called Plan New Jersey. It's an offshoot of the ARC of New Jersey. And what they are is a nonprofits that's set up is to provide that safety net when you're no longer there. And you can contact them, and for a couple $100, they'll come in, they'll meet with you and your son or daughter, they'll craft a life plan. And then when that life plan says, listen, when the time comes when you pass away, we're going to be the people. If your son's the trustees in San Jose or Dallas, we're going to be the people that are going to come and check on the quality of care. If they're in a group home, we're going to be coming in unannounced once a month. We're going to be sure she's getting all her benefits. And what they'll do is they'll charge a fee for that on a monthly basis, but they will be professionals on the ground coming into places unannounced to be sure that the quality of care is maintained for your son or daughter. So I'd encourage you, keep in mind Plan New Jersey as a resource on someone to have oversight when you're no longer able. All right, almost the last thing here. We're going to have, a lot of people have talked about ABLE accounts. So a woman earlier in our presentation talked about a 529 account. A 529, it's a section of the tax code, 529, was set up under the Bush administration, second Bush. And what it said was, hey, we want to be able to save for college. So it allowed you as parents to take money, put it in an investment account. It would grow. No taxes would be paid on it. And as long as it was used for college, you could withdraw it from the account, not pay any taxes. And it was great for college. So you could grow your money without paying any taxes. So it was a nice benefit. So as people with special needs children said, hey, we need the same thing for our kids. So what they did is a couple of years ago, about a year and a half ago, under the Obama administration, they passed the ABLE account. And the ABLE account allowed us to do the same thing. So we can take money, we can put it into an account, it can grow tax-free, and we can use it for our children's benefit. So the ABLE account is a nice tool. So let me tell you where it works well and where it doesn't. Pros, what are the pros? One, it can hold up to $100,000. So it doesn't replace a special needs trust, but it can hold up to $100,000. And that money won't, remember that $2,000 limit we talked about? It won't count towards that. You could have $100,000 in there and it will not count towards SSI and Medicaid eligibility. The funds grow tax deferred, just like a 529. It doesn't require a trust document. That saves some money. The child can contribute to reduce assets. So you can, if your son or daughter, again, working at Wegmans and they're earning a lot of money and all of a sudden, ooh, they're going to get above that $2,000, they can put some of their own money in. Actually, the child can contribute up to $15,000 of their own money into that account. And we can add $15,000 each year. So it allows us to put money in and a child to put some of their wages in. So those are the good things about the account. What are the cons? Here's the cons. At the death of the beneficiary, so if I had one set up for my daughter, at her passing, before any money passes to her brother or any other siblings, what's going to happen is in New Jersey, New Jersey gets paid back. They get paid back for anything they paid for. They say, we want to get paid back for ours. And the other limitation is, in a special needs trust, when you pass away and you sell your house for $300,000, you can have all that money go into a special needs trust. That cannot happen in an ABLE account. An ABLE account has a $15,000 a year contribution from us. So there's some limitations. It's a nice tool. Where it's used best is where we have children who are doing well. Maybe they're working and they're earning good money and they're going to go above the limitations for SSI. You can use the ABLE account to funnel some of their income into there and protect them. All right, so here's a chart. It just shows the three different trusts. And I can get this to the Yale School team and they can get that out to you so you can see it all simple in one place. All right, couple of things. Selections of trustees, friends, family members, corporate trustees. So when you select trustees, oftentimes people look for families, family members. Listen, I love my other siblings, but some of them, they don't got the DNA to be trustees. Trustees have to have the ability to say no. You need people with good character. Not that my family doesn't have that, but some of my other siblings have different struggles and would not be good trustees. So I tell you, look outside your family, look out to friends and see who could be a trustee. Remember, people go, well, I don't think that person can be a trustee because they need to know about investments or they need to know about medical or about benefits. No, they don't. They need to have a good value system, be able to say no, be able to say yes, be someone that's going to put your child's interest at the core of their decisions, and they can hire everybody else to help them. So that's one option. You can use corporate trustees, such as accounting firms and law firms. And then some people will hire a law firm or a corporate trustee, and there's trustee services in South Jersey you can use, and they'll have family members as co-trustees. One final note on this for people that say, look, I really don't have a lot of assets. To create a trust for a couple of $1,000s doesn't make sense, but I do want to take whatever I have and I want to leave it for the benefit of my special needs adult child. I just don't have a lot of money. You can leave it to a pooled trust. So the ARC of New Jersey, you can say to the ARC, I have $25,000 or $30,000. I want to leave that. I don't want to leave it to my son because he won't get benefits. So they'll put it in this pooled trust and then the ARC will provide for his benefit, or Plan New Jersey. So just another option. Distributions from the trust, just so you know, no cash can go to the beneficiary. You got to pay people directly from it and they'll audit you. They'll pay third party directly for service. So you pay the cable company, you pay those people, don't give it to your special needs adult. But it can be used for anything that the government doesn't pay for, which is a lot of things they don't pay for. They don't pay for cable TV. They don't pay for telephone. They don't pay for laundry. They don't pay for internet. They don't pay for dental. These are all things. They don't pay for travel. So travel and recreation. So, I have it in my trust that, listen, when I pass away and my wife passes away, we have put in the words of the trust. If my son is going to Disney with his family and he wants to take our daughter with him and his sister, there's money in the trust to cover that cost. I want them to have a relationship and I don't want to be at a financial burden on them. So it can have recreation in their trips. It can have medical equipment, therapies. So all those different things can be paid for by the trust. Okay, this is to a point earlier about beneficiary designations. So yes, it's important you do not name your children as beneficiaries. So a lot of people have wills and trusts. I leave all my children equally. Get rid of it, change the will. Life insurance. You filled out the life insurance form when you took it at work or when you took it from your insurance agent and you said, hey, who's beneficiary? Well, my wife's the beneficiary. Well, who's the contingent? Contingent, all my children equally. Can't be. So you would make your wife the beneficiary, and then the contingent would be, it could be one of your children and the special needs trust for Kelsey Byrne, dated February 17th, 2021. So you can make the trust the beneficiary of it. Retirement plans, IRAs and annuities, check those. Oftentimes you filled out your 401k when you first started at your company. Who's the beneficiary? My wife. Who's the contingent? All my children equally. Go back and change those. These are catastrophes that can happen, and I've seen them happen where people didn't know, they forgot to change it, and a big problem, and all of a sudden they lose all their government services. Beware of savings on behalf of a child. Sometimes people have these savings bonds that they've stuck in the drawer, and they've had them there for 20 years, and all of a sudden they find out, oh, I got these bonds. Life insurance trust. So just be cautious of those things. Be sure the children aren't the beneficiary. This is a kind of an odd thing, but I think it's really appropriate, and most people are unfamiliar with it. So in New Jersey and many states, when our parents get older, what a lot of people will do is they'll say, look, I don't want to, if I have to go in a nursing home, I don't want to spend down all my assets and have nothing go to my children. So what I'm going to do is I'm going to take my assets, and a lot of older grandparents will do this. They'll take their assets and they'll put them in a trust, and they'll say, I'm going to put those in a trust outside my name. That way, if I have to go into a nursing home, Medicaid will pay, and I preserve these assets for my family. Well, the government said, wait a minute, that's not fair. People are preserving assets, and then all the taxpayers are paying for their care. So what they did is they said, we're going to do a 3-year look back on all these creative trusts that people are doing. And people still continue to do them. So now they put a 5-year look back and say, look, if you transfer money into a trust, just so Medicaid can pay for your nursing home and you can protect your assets for your family, we're going to look back 5 years. And if you transferred in the last 5 years, we're not paying for your nursing home. You have to get those assets back, which is a good rule for the common good. But there's an exception in the law, and most people are unaware of it. If a grandparent has assets and they say, I want to leave those to a special needs trust, they can take their assets, put them into a special needs trust for a grandchild, for one of your children with special needs. And when they have to go into a nursing home and the government does their look back, there's an exception. Anything transferred to a special needs trust for a special needs child is exempt from the look back. So just something to keep in mind if you have a parent who's aging and is looking at exploring that, there's an exemption most people are unaware of. All right, last thing we're going to cover real quickly, an important thing, but it's often overlooked, is it's important for us as parents. We can put our special needs trust together. We can get the benefits. We can get the life insurance. So we have that going to the trust. We put everything else in place, but you need to put the owner's manual in place. And the owner's manual, let me just go to that. I'm going to go right through guardianship real quick because you're going to cover that in a couple of weeks. So when you think back on all the things you've learned at your child, and I don't know about your child, but my child has some idiosyncrasies. Certain sounds bother her, certain things have to be right in the same place. So all the benefits with SSI and Medicare, the housing assistance, reporting requirements, contacts and phone numbers. I'm doing this with my mother now. She's 90 and we're going through everything and I'm putting that together and I'm telling you, it's a thick book. But I'm getting the contact numbers, the care coordinators of all the different people. And my mother, what do you want for residential for my brother Chris, who still lives with you? You know, what do you want? Education's not so much, they're past that stage. What about medical care? What doctors do they use? More important than doctors, as you know, there's these special people that were put on the planet, and they're called special needs dentists. You know, what dentist works well with your child to lift that? What's their social life like? My daughter connects through Facebook and social media because she doesn't have friends in the neighborhood. At 8 years old, they stop knocking on the door. So her friends are dispersed, as people in the Yale School are dispersed. They're all over. If someone walked in and saw my daughter on the computer as much as she is, they'd say, that doesn't seem right. But you don't understand. There's no one next door for her. So having social media, letting them what their social life is like. She volunteers at Urban Promise in Camden. We want to keep that going. We're, you know, our church is a pillar of our family, and my daughter has been raised with that pillar, and I want to be sure she continues that. So that goes in the manual. So all those things, those routines, those little things that mean so much to them, their diet, their all those things, but to write that all down and put that on a letter of intent and keep that updated. So when the day comes and something happens, because it's all going to come for us, we just don't know when. Not only do you have the trust, you have the money, you have everything set up, but you have the owner's manual that you leave for whoever's following you so that they can give your child the best care possible. All right. So, and then share it with the family and let them know where it is. All right. So as I said, when I started, information without action, no, that's not good. So what we want to do is we want to go out. I encourage you from today's meeting, if you would just take 3 action items. And if one of the action items, I'm going to email Mike Byrne and get the name of a lawyer, or I'm going to email Mike Byrne and get the name of this, do that, but put that on your list, try and accomplish it. I encourage you. I'll stop for questions now. I want to be conscious of time. We're at 8:47. Wanted to be done by 9, I know, for all of you. And again, for those that have to leave, not a problem. You have my email there. You have my phone number. I encourage you, try and use email. It's easier. But if you have any questions at all, there's no cost. Again, this is, I've gone to these workshops where a financial or insurance guy gets up there and it's an infomercial to sell their product. It's not. I'm here to just give assistance to parents who are walking the same path I'm walking. So if you have any questions, feel free to email me, but now I'll stick around as long as necessary for questions now.